Welcome to the Senior Techie Podcast. I want to paint a picture for you that might feel, a little too real. Imagine you're sitting at your kitchen table.
We have all been there, honestly.
Right. The overhead light is glaring off that plastic pill organizer in front of you. You've got your reading glasses pushed down on your nose, and you're staring at three amber plastic bottles that look completely frustratingly identical.
Oh yeah, those tiny white labels with the microscopic fonts.
Exactly. You're squinting at the fine print, holding a little white pill in your palm, trying to figure out, wait, did I just take the morning dose or am I holding the afternoon dose?
It is a remarkably familiar scene. It happens everywhere.
And maybe this is your own kitchen table, or maybe it's your parents' table and you're visiting on a Sunday afternoon, observing this whole setup and feeling this sudden heavy wave of doubt.
Well, the very first thing we have to establish is that this moment of doubt you're describing, it's not carelessness. It's not a sign that someone is failing or losing their edge. It's exactly what happens when any human brain is tasked with managing an incredibly complex, high-stakes system with zero margin for error.
I'm so glad you said that because managing health is basically a full-time logistics job. And the statistics back this up in a way that I think will make a lot of people breathe a massive sigh of relief. Like, you aren't alone in feeling overwhelmed.
You really aren't. If you look at the data from the National Council on Aging, if you're over 65, there's a 93% chance you have at least one chronic condition.
Wow. 93%.
Yeah. But here's the kicker. More than 3 in 4 people are juggling 2 or more.
3 out of 4. That means juggling multiple conditions isn't the exception. It's the absolute rule.
It's the baseline norm. And when we look closer at what that actually translates to on a daily basis, research from the National Institutes of Health shows that older adults with multiple conditions average 5 different diagnoses and 7 distinct medications.
Let's really unpack that for a second. 7 distinct medications. This isn't just popping open a multivitamin bottle.
No, not at all.
Each one of those 7 prescriptions has its own specific, rigid set of rules. Like, this one needs to be taken with food so it doesn't wreck your stomach. That one on completely empty stomach so it absorbs properly.
Right, and this one first thing in the morning. That one right before bed because it makes you drowsy.
Oh, and they all have completely different refill cycles.
Which means the system is incredibly fragile. In any industry, complicated systems always fail at the handoff points.
The handoff points. Okay, tell me more about that.
In healthcare, the handoff is where a pill accidentally gets skipped because the phone rang, or a critical instruction from a doctor gets misheard because you were trying to grab your coat and walk out the clinic door.
So our mission for this conversation is to fix those handoff points. Whether you're managing your own health or you're stepping in to help someone you love, we want to give you an empowering guide to managing these systems without losing an ounce of independence.
Because managing all this, it's a math problem. It's not a memory problem.
I love that. A math problem, not a memory problem.
Right. Nobody should be relying on sheer willpower to remember 7 varying drug schedules. The framing changes everything.
It really does.
The math simply doesn't work without a solid infrastructure in place. Older adults consistently report that they want to manage their own medications, even when well-meaning family members offer to step in and just take over. So our goal is to build systems that support the person doing the managing.
And here at the Senior Techie, we're all about exploring those practical tools, giving you exactly what you need. We want to look at both the analog fixes and the digital ones. You're among friends here. This is a supportive community, and nobody is getting left behind.
Absolutely.
So let's tackle this math problem of medications. My instinct, honestly, is to immediately pull out my phone and start searching the App Store for something to track all 7 of those pills.
Yeah, that's a super common instinct, especially in our modern world. But honestly, you want to start analog before you ever touch a digital screen.
Really? Start analog.
Yes. If you jump straight into a complicated piece of software, you're just adding a brand new layer of digital complexity on top of a broken physical foundation.
Right, because if I don't actually have the pills in my house, an app pinging me to take them isn't going to help at all. So what does fixing that physical foundation look like?
It starts with the absolute basic logistics. First, call your pharmacist and ask for a synchronized refill date.
Wait, I always forget this is an option. I assumed you were just at the mercy of whatever day the doctor wrote the prescription.
You're definitely not. Instead of making 4 separate trips to the pharmacy in a single month, or trying to track 4 different mail order packages arriving at random times, The pharmacy can adjust your initial pill count so everything aligns.
Oh, that makes so much sense.
Yeah, you arrange for every single prescription to be picked up
Yeah.
on the exact same day of the month. It drastically reduces the cognitive load of constantly wondering, like, am I about to run out of my blood pressure meds?
That's such a simple, massive weight off the shoulders. But I imagine where you get those refills matter just as much, right?
It really does.
Because a lot of folks shop around, getting their cholesterol meds at the grocery store pharmacy because it's cheaper, and their arthritis cream at the big chain down the street. That seems like a giant blind spot.
It is a massive blind spot, which brings us to step 2, which is stick to exactly one pharmacy for everything.
Okay.
When you bounce between different chains, their computer databases do not talk to each other. Nobody has the complete picture of what you're putting into your body. Using one centralized pharmacy means there's one single computer system and one pharmacist actively monitoring your entire profile for dangerous drug interactions.
That makes a ton of sense. The pharmacist software can only flag a dangerous chemical reaction if it actually knows all the chemicals you're taking.
Precisely.
Okay, so we've got the pharmacy side locked down. What about the doctor's office? I always feel like I'm drinking from a fire hose when they rattle off medication changes.
That's step 3. Never rely on the verbal rundown.
Yeah, it's just too much information.
Exactly. When you're in the doctor's office, you're stressed, you're trying to remember your own questions, and it's loud. So demand a printed medication list at the end of every single visit.
A physical printout.
Yes, not a digital portal message you have to hunt for a week later and try to remember your password for. You want a physical piece of paper you can hold in your hand, take home, and compare side by side against the bottles on your kitchen counter.
I love that. Paper is undeniable.
It really is. And speaking of undeniable physical evidence, before we even touch a smartphone, step 4 is to set up a visible weekly pill organizer across the room.
Wait, across the room, why not right next to the coffee maker or the toaster where I'm guaranteed to see it every single morning?
Because if it's right in the middle of your standard routine, you can develop routine blindness. You just look right past it.
Oh, wow. I never thought of that.
Yeah, but more importantly, placing it across the room forces a physical action. If it's Thursday evening and you can clearly see from your armchair that the Thursday morning slot is still full of pills, you have immediate, undeniable physical evidence of where you stand.
There's no guessing.
Exactly. There's no guessing.
Okay, that's incredibly smart. So we have our refill dates synced to one day, a single pharmacy acting as our interaction safety net, printed lists in our hands, and a physical pill organizer providing visual evidence. The physical foundation is rock solid.
It is.
Now, how do we layer in the technology as our backup alarm?
This is where we look at what you probably already have sitting in your pocket. If you have an iPhone, there's a built-in medications app right inside the default Apple Health app.
Oh, really?
Yeah, you don't have to download anything new and you don't have to create a new account. It handles scheduling, it sends you refill reminders, and it even cross-references your list to warn you about potential interactions.
Okay, I have to push back here for a second. We talk a lot in the senior techie community about how intensely frustrating modern software can be.
Oh, absolutely.
Aren't most of these health apps built by 25-year-old software engineers in Silicon Valley for other 25-year-olds? I mean, we're talking about tiny little gray buttons you can barely tap, confusing swipe menus, and notifications that just vanish into thin air before you can even get your reading glasses on to see what they say.
You're absolutely right to push back on that. And your frustration is entirely validated by the actual research.
Really? So it's not just me?
Not at all.
Yeah.
There was a major usability study confirming exactly what caregivers and seniors have suspected for years. Most popular reminder apps were fundamentally not designed with older adults in mind. They failed on contrast, touch target size, and cognitive load.
Vindicated. I knew the interface was the problem, not the user.
It's a very real systemic issue in software design. However, the landscape has improved significantly in recent years. Apps that specialize entirely in this space, like MediSafe, have finally realized who their actual core users are.
That's great to hear.
Yeah, they now feature much larger text, high-contrast buttons, and simpler, sustained alarm sounds that don't just disappear after one tiny ping. But the most powerful feature in these specialized apps is something called Caregiver Sync.
Caregiver Sync. Okay, let's define this jargon for a second. What exactly does that mean in plain English?
Think of Caregiver Sync like having an adjoining door in a hotel room.
Okay, I'm picturing it. 2 separate rooms, 1 door right between them.
Exactly. You and your family member each have your own separate private rooms. Those rooms are your individual smartphones. You have your complete privacy, you're managing your own space, your own daily schedule, and your own medications.
So the caregiver cannot see every little thing you do.
Right. But if a genuine emergency happens, say a crucial dose gets missed and isn't logged for several hours, that adjoining door allows the app to gently tap the caregiver on the shoulder in their own room.
Ah, so the app basically slips a note under that adjoining door. It sends a specific notification to the caregiver's phone only when a threshold is crossed.
Precisely. That way, the caregiver isn't hovering. They aren't micromanaging or constantly texting to ask if pills were taken, but they get that gentle tap on the shoulder when help is actually needed.
Which completely avoids that panicked phone call 3 hours later asking, "Did you remember to take your heart pill?"
Exactly.
That's such a graceful, dignified way to handle it. It preserves the total independence of the person managing their own health, but it provides incredible peace of mind for the family. It's a true safety net.
It really is. But we have to look at the bigger picture here. Managing pills perfectly with alarms and organizers won't do much good if the physical body taking those pills isn't properly fueled and moving.
Right, because we've built this incredibly robust system to ensure the right pills are taken at the right time. But none of that matters if the body taking those pills is too weak to safely walk across the kitchen to get them.
That's the reality.
When we talk about maintaining independence, the biggest threat out there isn't a missed multivitamin, it's a physical fall.
Without question, the statistics on falls are sobering. A fall can turn a completely healthy, vibrant 78-year-old into a hospital patient quite literally overnight. It fundamentally alters their trajectory.
And for a caregiver, it turns a calm, manageable week into an absolute crisis.
Yes. So how do we actually fortify the body to prevent that?
I assume the prescription here is exercise, but doctors just saying stay active always feels incredibly vague to me. What does that actually look like in practice?
It is vague, which is exactly why the National Institute on Aging published very specific guidelines. They recommend 150 minutes of moderate aerobic activity every week, plus muscle strengthening activities on 2 separate days.
Let me be completely honest. For a lot of folks in our audience, especially if there's a knee that constantly complains or a heart condition that a cardiologist is keeping a close eye on, 150 minutes plus strength training sounds incredibly daunting.
It does.
It sounds like a massive mountain to climb when you're just sitting on the couch trying to figure out where to start.
It does sound like a massive number when you look at it all at once.
Okay.
But the critical piece of the NIA's guidance is to start gradually and, more importantly, to combine the aerobic work with strength and balance exercises. You do not have to treat them as entirely separate, exhausting projects.
It's funny you say that because treating strength, balance, and aerobic work as completely separate chores always reminds me of baking.
Baking, how so?
Yeah, it's like trying to bake a cake by eating a handful of raw flour, then eating a spoonful of sugar, and then drinking a raw egg all separately.
Well, that's a terrifying mental image, but structurally very accurate.
Right, it doesn't work. You have to mix the ingredients together into your actual day.
Yeah.
So instead of blocking out an exhausting, sweaty hour at the gym, you mix it up into the batter of your routine.
Exactly.
You take a 20-minute walk after breakfast for the aerobic part. Then, later in the afternoon, while you're watching your favorite television show, you do 10 minutes of seated chair exercises for strength. You just fold it in.
That's exactly the right approach. And the stakes for getting this mix right are incredibly high. A systematic review published through the National Library of Medicine looked at various exercise interventions for older adults.
What did they find?
They found that combining resistance training with balance work produced the absolute strongest results for improving physical function and actively preventing falls.
Let's break down why that combination works so well. I imagine it's about the mechanics of the body, right?
It is.
Balance work trains the brain to know where the body is in space, but resistance training gives you the actual muscle power to catch yourself when you stumble.
Exactly. Proprioception, knowing where your limbs are, is useless if your muscles aren't strong enough to quickly correct your posture when you trip on a rug.
That makes total sense.
Maybe building that strength looks like taking a Tai Chi class at the local senior center twice a week. Because at the end of the day, the exercise that actually works is the one that gets repeated.
Consistency over intensity. But of course, you can't build that muscle to catch yourself or maintain your balance if you aren't properly fueling the machine. Nutrition is the other half of this physical foundation.
And it's the piece that rarely gets explained well in the context of chronic conditions. Poor nutrition and medication management feed each other, and unfortunately, they do it in a very destructive loop.
A destructive loop. How?
Well, research from the National Institutes of Health, drawing on massive national health surveys, has linked poor nutrition directly to two major issues in older adults. First, declining physical function, and surprisingly, increased medication errors.
Wait, missing a meal or eating poorly actually leads to messing up your pills? What's the connection there?
It's entirely physiological. When you're malnourished or dehydrated, your blood sugar drops, your brain doesn't get the fluid it needs, and your cognitive function dips. You get brain fog.
Oh, I see.
The frontal lobe, which handles complex tasks, struggles. That's when the mathematical puzzle of managing 7 different medications falls apart. You literally lack the physical brain energy to remember if you took the Tuesday pill.
Right, so the brain fog is the literal bridge between a nutritional deficit and a medication error. That's a huge revelation.
It is.
But we also have to recognize the barriers here. Cooking can become a massive burden. Standing at the stove is physically exhausting, carrying heavy grocery bags is tough on the joints, and the mental math of navigating high grocery prices is draining. What are the practical options?
This is where programs like Meals on Wheels come in, and we need to completely reframe how we think about them.
Yeah.
Meals on Wheels is not just a food delivery service.
It's not.
No. The organization's research library compiled a review of 38 different studies, and the findings are profound. Regular meal delivery reduces social isolation, it cuts hospitalization rates, and it actively helps people avoid nursing home admissions.
That's staggering. It's clearly doing so much more than just dropping off a hot plate of food. What's the mechanism behind those numbers?
It functions as a daily in-person wellness check. Someone is physically knocking on the door, making eye contact, and saying hello. If the person doesn't answer or looks distressed, that volunteer alerts the family or authorities.
Wow, so that human connection is a critical safety net that breaks the isolation.
Exactly, and it doesn't have to fall entirely on the family's shoulders.
And this ties right back into the ethos of our community at the Senior Techie. We want you to use every single tool available in the tool bag. There's a fantastic national resource called the Elder Care Locator. You can use it to find your local area agency on aging, and they will point you directly to the nutrition programs available in your specific county. We really need to remove the guilt from asking for help with meals.
Yes, please.
Letting someone else cook is a strategic move to maintain your overall independence, not a surrender of it.
Absolutely.
Yeah.
It's a sign that you're managing your overall systems wisely and delegating the right tasks.
Now, even with the perfect balance routine folding into your daily batter, and even with top-tier nutrition keeping the brain fog away, accidents are just a reality of gravity and slippery flippers. People trip over rugs, they slip on a wet bathroom tile.
They do.
Let's talk about the ultimate invisible safety net for when a physical fall does occur, which is smartwatch technology.
The advancements here are truly life-saving, and they operate entirely in the background. If you or your loved one is wearing an Apple Watch, and the wearer is 55 or older, a feature called fall detection likely turned itself on automatically the moment that age was entered into the user's health app profile.
I bet a massive number of folks who bought that watch just for step counting or reading text messages have zero idea this invisible safety net is just sitting on their wrist, completely active.
Plenty of people have no idea.
Yeah.
Which makes it so incredibly important to manually double-check your settings.
Okay, I have a very practical, grounded question about this because technology can be notoriously finicky.
Sure.
Let's say I'm in the kitchen, I take my watch off to wash the dishes, and I accidentally drop it on the hard tile floor. Is my watch going to automatically call the fire department and send a fleet of paramedics to my house over a dropped piece of jewelry?
It's a great question, and the answer is no, because the algorithm is remarkably sophisticated. It uses accelerometers and gyroscopes to understand the trajectory and impact.
Okay, so it knows the difference between a dropped watch and a falling person.
Yes. Apple support documentation details the exact step-by-step sequence of how it responds to what it calculates is a genuine human fall. First, if it detects that hard fall, the watch will physically tap your wrist, sound an audible alarm, and display a prominent on-screen alert.
Okay, so it gives you a clear warning before doing anything drastic.
Yes. And if the watch sensors detect that the wearer is moving around after the impact, it just waits. It assumes you are okay and waits for you to manually respond to the alert and dismiss it by tapping, "I'm okay."
But what if someone actually falls and they're unconscious or they're hurt too badly to reach over and tap the screen?
If the watch senses complete stillness for about a minute, The protocol escalates rapidly. It begins a loud 30-second countdown. It makes a very distinct, escalating noise designed to alert anyone nearby.
And if no one hears it?
If that 30-second countdown ends and you still haven't moved or canceled it, the watch automatically calls emergency services on its own.
Wow. That's an incredible sequence of events happening entirely on your wrist.
And it goes a step further. After it connects with 911, it immediately notifies your designated emergency contacts, sending them a text message with your exact GPS location.
That's amazing. But when it calls 911, how do the paramedics know what they're walking into? They don't know who's wearing the watch.
That's where the medical ID comes in.
Let's identify that jargon. What is a medical ID in this specific context?
Think of the medical ID like a digital medical alert bracelet that's tucked away securely inside the software of the watch.
A digital bracelet, okay.
When paramedics are dispatched, or when they physically arrive and look at your watch screen, this digital bracelet can literally hand them your entire medical history. It displays your chronic conditions, that list of 7 medications, your severe allergies, and your emergency contacts before they even have to ask.
That saves crucial life-saving minutes in an emergency where you might not be able to speak. But for all of this to work, the fall detection, the calling 911, the messaging family, the watch actually has to be connected to the outside world, right?
Yes, and this is one major technical caveat we have to define very carefully. The watch must have a connection to transmit the distress signal. It needs to be connected to Wi-Fi, or have its own cellular data plan, or have a paired connection to an iPhone.
A paired connection. Let's give that a real-world equivalent so we're completely clear on how it functions.
Imagine the Apple Watch as a standard walkie-talkie.
Yeah.
Walkie-talkies have a very limited range.
Right.
The paired iPhone is the powerful relay station sitting nearby. If the watch senses a fall, it uses its short-range walkie-talkie signal to contact the relay station. The relay station, the iPhone, takes that signal like a baton in a relay race and uses its large, powerful cell antennas to push the call out to the global emergency network.
So if I walk down the street to get the mail and leave my iPhone on the charger inside the house and I'm just wearing a standard non-cellular watch,
it won't work.
that walkie-talkie has no relay station to talk to. It's just shouting into the void and the signal can't get out.
Precisely. Which is why checking that connection status periodically is just as crucial as checking the battery in your hallway smoke detector.
That makes total sense.
If you're a caregiver, checking that the phone and watch are successfully paired and connected is an incredibly easy, high-value thing to build into your regular Sunday visit.
We've covered so much ground here. We've moved from organizing physical pills at the kitchen table to setting up adjoining digital hotel rooms. We've talked about mixing exercise into your daily batter and strapping invisible safety nets to your wrist. It can feel like a lot to process all at once.
It can absolutely feel overwhelming, which is why nobody needs to overhaul their entire life in a single afternoon. That's a recipe for burnout.
Exactly.
Yeah.
So let's leave you with a menu of single, highly manageable steps. Our Getting Started checklist. You don't have to do all of these. Just pick one to focus on next.
That's a great approach.
Number 1, call your pharmacy and simply ask about synchronizing your refill dates so everything arrives on the same day.
Number 2, sit down with your smartwatch or smartphone. Check if the fall detection setting is active and take 10 minutes to fill out that digital medical ID. Doing that together with a family member over a cup of coffee is a great low-stress activity.
Number 3, schedule just one 20-minute walk. Don't worry about mapping out an entire week of workouts. Just fold one walk into your routine.
And number 4, call your doctor's office and request a physical written list of every current medication and dose you're prescribed so you have that hard copy on hand.
Remember, managing multiple chronic conditions is a daily reality for 93% of people over 65. You aren't alone in this, and pretending the complexity doesn't exist doesn't help anyone.
No, it doesn't.
But the tools we have available right now, from a seamlessly synchronized pharmacy schedule to a digital watch that can literally call for help when the room is empty, they beat what existed even 5 years ago by a massive margin. Nobody is behind here. Everybody is just starting out with better information than they had previously.
And if you're looking for more structured, evidence-based support, the CDC has a fantastic, completely free guide on living with chronic conditions. Apple also hosts a very clear step-by-step support page that walks you through the fall detection setup.
As we wrap up, I want to hand it over to you for one final thought. What is something our listeners can take away and chew on?
I'd leave you with this question to ponder. If a tiny algorithm on a smartwatch has been trained to recognize exactly when we're in physical distress and need immediate help, how might we train ourselves to be just as observant?
Mm.
How can we become that attuned to our own daily habits and the subtle, quiet signs our bodies are giving us, long before a crisis even happens?
That's a brilliant thought to end on. This podcast was brought to you by The Senior Techie. It's available on Apple Podcasts, YouTube, and Spotify. If you'd like to receive their free newsletters, you can subscribe at subscribe.theseniortechie.com.